I do come to Quincy. You will see a couple of our Quincy dedicated ambulances, paramedics, and EMTs coming through today to sort of give us a hand. And we have a handful of other guys over here if they want to introduce themselves.
I'm Ryan, EMT down in Plymouth.
Hi, I'm Lisa, EMT in Taunton.
Nicole, an EMT in Brockton.
I'm Lauren, I'm a paramedic.
I'm Karen, I'm an EMT in Weymouth.
Paul, I work down in Brockton.
And that's Polly works in Brockton. So bear with us today. We're going to do the PowerPoint, which I know is not like the most riveting and exciting thing, but it is something that we do have to go over. So we'll go through the PowerPoint, and then we're going to run people through 3 stations, okay? And then after that, you should be prepared to go out and save lives, yes? Has anybody ever, other than our middle schoolers who were here this week, has anybody else ever been certified in CPR before? Okay, so for a lot of us, it's a review. I apologize over here if it feels like my back is to you. I don't have anywhere else to put the thing, so I apologize. All right, heart disease is the #1 cause of death in the world, more than 17 million deaths per year. Cardiovascular disease claims more lives than all forms of cancer combined. Early recognition and CPR are crucial for survival of cardiac arrest. All right. This is called the chain of survival. This is for an out-of-hospital cardiac arrest, which is what we're going to focus on, right? What's the difference between an out-of-hospital cardiac arrest and an in-hospital cardiac arrest? You're not in a hospital, right? In the hospital, if somebody goes into cardiac arrest, there's doctors, there's nurses, there's everybody. Way too many people, if you ask me, but I also work on the road with one other person. So we're going to talk about out-of-hospital, so at home, on the street, at the gym, anywhere like that, okay? So it starts with early recognition and activation of the emergency response system. What do you think we mean by early recognition? Or recognition? What are we recognizing? Say it again? So prevention, that's it. Yeah, we want to, if somebody looks like they're ill, we want to maybe call 911. What else? What else are we going to what do we want to recognize? Yes? If they're breathing or not, if they have a pulse or not. We want to recognize if this person needs CPR. How do we activate the emergency response system?
Phone?
Phone? Who we calling? 911. Perfect. It's nice to know where you are, so if you can give them the information about the address where you are, who you're with, they're going to ask you a whole bunch of questions. Also, they will talk you through all the steps of doing CPR, okay? Immediate high-quality CPR. So what that means is don't waste your time. We're going to go over like good technique and maybe not great technique. If you're not doing high-quality, good technique, you're just tiring yourself out, okay? The most important thing when somebody goes into cardiac arrest, the most important thing that you can do for them is high-quality chest compressions, okay? Otherwise, my friends that were with us all week, my middle schoolers, how exhausting was it when we had you do the CPR? Oh, please, all I heard was, it's hard, I'm tired, my hands hurt. They were great, but it's exhausting. You get sweaty, it's a lot. Rapid defibrillation. What do we use to defibrillate somebody? A defibrillator, right? An AED if we're outside the hospital. Basic and advanced emergency medical services, so those are your EMTs and paramedics. And then advanced life support and post-arrest care at the hospital. Our pediatric chain of survival is a little bit different. It's going to start with prevention. Can anybody tell me what the #1 reason for pediatric cardiac arrest is? Choking or a hypoxic, like no oxygen emergency. So we're going to start with prevention. So that would mean making sure that our like little pieces are up off the ground, that we're cutting food appropriately for kids, but also that we know how to do proper choking maneuvers for babies, which we're going to go over today. And again, early high-quality bystander CPR, rapid activation, and then your ambulance, and then post-arrest care, which is when they're at the hospital. What's a heart attack?
The heart stops pumping.
So that's our cardiac arrest. A heart attack is going to be when people use them interchangeably, which is why there's a whole slide about them. Our heart attack is going to be when there might be like a blockage in the heart's own vasculature, so it's all just the heart, versus our cardiac arrest, which happens when the heart stops pumping and you stop breathing. Cardiac arrest, to say like, oh, this person's in cardiac arrest, is a nice way of saying this person is dead, okay? No beat, no heart beating, no breathing. Warning signs of a heart attack: chest pain, arm, jaw, back pain, shortness of breath, nausea, vomiting, pale, cool, sweaty skin, impending feeling of doom. It's true. I mean, they'll tell you nothing worse than when you go in and talk to a Nana who says, I feel like I'm gonna die. Like, you take those very seriously. There are plenty of people who I don't take it seriously for, but there is a certain population that tells you that, and you think, not with me, let's just get to the hospital. All right, so CPR, cardiopulmonary resuscitation. Cardio referring to what part of the body? The heart. Pulmonary referring to lungs, and resuscitation meaning bring it all back, right? So we want to simulate heartbeats. How are we doing that? Compressions. When we're doing chest compressions, we're actually trying to squeeze the heart to pump the blood throughout the body. So we squeeze the heart when we do our compressions down. When we come up, we're letting the heart fill up with blood again. And then when we push down, we're squeezing the heart to pump the blood throughout the body. Does that make sense? So when we're talking about the pulmonary resuscitation, that's sort of going by the wayside. Anybody who watched Baywatch in like the 80s and early 90s, they did 5 chest compressions and then like a breath or 2. They weren't doing anything. Really, I promise you, the only thing that matters is chest compressions. Even when I get there, like there's different levels of ambulances. There's BLS and ALS. Your paramedics, which are your ALS, come with medicines and monitors and, you know, put the breathing tube in. They found none of that really matters. It's really just about the compressions, okay? Which we can all do after this. Probably not. But when they say pulmonary, they refer to breathing for somebody. So mouth to mouth, which we'll get into, not getting into. Circulation, airway, and breathing. That's what we want to focus on. Mostly circulation. So these are CPR masks. You may see people have them like on a keychain, or they may be with the AEDs. They're a barrier. We don't want to put our mouths in other people's mouths. Compression ratios. For kids and adults, it's going to be 30 compressions to 2 breaths. I teach a lot of CPR classes to nursing homes and to fire departments. For the test, it's 30 to 2, okay? In real life, and I think probably in the next couple of years, you'll find that they're gonna change all these. It's compressions until the cows come home, which means like the ambulance shows up, which I guess is self-deprecating, but that's okay. So 30 compressions to 2 ventilations if we were taking a test. For us, we wanna just do 30 compressions, okay? Good compressions. The rate is always going to be 100 to 120 compressions per minute. That seems tricky, right? If any of you have seen The Office when they have the scene and they try and do the math, and it's so silly. So we have a couple of songs that you can sing in your head or out loud here if anybody feels that they can. So Staying Alive, that's an optimistic and good one. For the cynics, we have another one, Bites the Dust. Hips Don't Lie by Shakira, that's a good one. Eye of the Tiger, the Darth Vader's March, Baby Shark, Ice Ice Baby, and Glory Days. Those are all songs that have a beat that you can do your compressions to. So when we do, is there a Taylor Swift song? Which one? You can't tease me with that, man. Come on now. It would have been it would have been highlighted. It would have been in sparkles. So these are songs that you can keep in your head and do your compressions to, okay? We'll play some of them like from my phone, because that's, I guess, what we're doing here. I didn't bring a speaker, so I'll just walk around with a DJ with really some annoying songs that'll get stuck in your head for the rest of the day. So the depth, so how far we want to press into the chest. It's a third the depth of the chest. For an adult, it's going to be 2 to 2.5 inches. For a child, 2 inches. And for an infant, 1.5 inches. Do we bring a ruler and measure this? Like, do we set up our phone on measure? No. You'll know what feels right, and you'll practice on the mannequins, okay? All right, so our first step. Hey, are you okay? We're gonna assume that this person is not okay. That's why we're here, right? So you'll get no response. If unresponsive, if you're alone, go get the AED if you're somewhere that knows has them. Where are some places that have AEDs? Gyms? Schools? Trains, planes, yep, boats. Museums. Some apartment complexes. A lot of big public places have AEDs. Your libraries, they're pretty much everywhere now, which is pretty nice because it matters. So if you're alone, hey, are you okay? They're not okay. Go get your AED and return to the victim. If someone else is available, send them to go get it, and you start getting to work doing CPR. We also want to use our cell phone, call 911, put it on speakerphone right next to where you and this person are, and tell them what's going on while trying to help them. Check for breathing. If they're breathing, monitor the victim until additional help arrives. If they're breathing, do they need chest compressions?
No.
Perfect.
Or talking.
Or talking, yep. If not breathing, or agonal respirations, does anybody know what agonal respirations mean?
They kind of do this.
Yeah, so they're gasping or gupping. These are the last few breaths that someone will take before they go into cardiac arrest usually. So if they're not breathing or they're just like gasping, gupping, these could be signs. These are signs that there's a cardiac arrest and we want to start CPR. Consider Narcan administration if you think there's an overdose. Now a lot of our AEDs also have Narcan in it, or even some like stop the bleed kits for your first aid. Who can tell me what we use Narcan for? For an overdose. It's for an opiate overdose, yeah. And you can also carry it. You can get it at the pharmacy, carry it with you. I think usually it's this one, right? You guys have all seen this one around. Does anybody know how to use it? Yep. Do you know how to? Tell me what the steps are. I know it seems silly because it's manufactured to be easy, but tell me what your steps are. Yep. That's right. They're very user-friendly. So we're going to put our 2 fingers right here and your thumb on here. You're going to just stick it up their nose and press the button. We don't want to press the button before it's up their nose. You don't want to like test it or prime it because that wastes it. Are you going to hurt somebody if you give them Narcan and they're not having an overdose? No. So that yes is a good answer because like who wants to be administered a medicine that they don't need? Narcan is very safe for people who might not be experiencing an overdose and life-saving for somebody who could be. All right, so if you find your victim doesn't have any pulse, we want to start compressions. All right, can anybody tell me how many compressions it takes to build a blood pressure to get the blood to the vital organs? Because that's what we're doing, right? We're pumping the heart to get the blood to the organs. When it's not pumping, everything's just like flaccid. You start pumping, you got to get up that pressure, which is your blood pressure. How many compressions do you think it takes to get the blood to the lungs, the heart? Yeah. 60, good guess, no? 30, no? Say it again. 120, no? 100, these are all very good guesses. It's 15. So when you get down on somebody's level and you start doing compressions, your first approximately 15 compressions are just building up the pressure to get that blood to where it needs to go. After that, you're actually doing the perfusion, which is what we want to do. You're actually getting that blood to where it needs to go. So every time you come off the chest, when you say like, ugh, I'm tired, or you say like, I don't know, is there something else going on? Anytime you stop your compressions, it goes back to 0. Your first 15 are going to be to build that pressure, and anything after that is when you're actually perfusing. When we're doing chest compressions, we want to do it on the bare chest. I know that's like kind of silly, especially for like our middle schoolers, that you have to expose somebody's chest, but what do you think is worse, being exposed or being dead? Being dead. You know, we want to give people some, you know, humility, and we want to be able to, you know, we're not just exposing chests left and right if we don't need to, but you do need to do quality compressions. You'll put the heel of one hand just below the nipple line, right in the middle, so the heel of your hand right there. And you're going to put your other hand over it, interlock the fingers, keep the elbow straight, be directly over the victim. Can I have some of my friends here just come show us? If 2 people could grab adult mannequins and just right here for me. Thank you guys. All right, so if you could just set up, put yours down right there. And if you don't mind coming over here. So you're gonna be at your victim's side, okay? You're gonna be kneeling down at your victim's side. All right, so if you guys could just show them. We're gonna put one hand up, right? We're gonna use the heel of that hand, middle of the chest. Your other hand is gonna go on top, and we're gonna interlock our fingers. Do you just mind holding your hands up and showing them how you're doing that? You just show them how your hands are. All right. We want to make sure that we are square over the body so that our shoulders are parallel to the victim. This way we can use our whole body weight to do our compressions, opposed to just our arms. If you just use your arms, you're going to get very tired. None of you are actually as strong as you think you are when we're doing this, because this is not something you do at the gym, right? So we want to make sure we're using our whole body. Keep our elbows locked and straight, and we're going to press down. Go ahead. See how we're using our whole body right over? Perfect. All right, who could name me some of those songs that were up there that they could be listening to in their head? Staying Alive. Staying Alive. Ice Ice Baby. Eye of the Tiger. What did you say? Baby Shark. The Darth Vader song. I know that was a rude way to say it. If you're a Star Wars fan, I know there's an actual word for it, name for it, and I apologize. I don't remember what it is. It's the Darth Vader song.
Imperial March.
Imperial March. There we go. Thank you. I do know that I was being ignorant when I called it that. I just want to let you know. All right. So again, in here it says, give your 30 compressions and then 2 breaths. I want you all to, not that we want to ignore what the PowerPoint says, but I want you all to ignore what the PowerPoint says, and we're just going to do compressions, okay? The breaths don't matter, and there's lots of germs involved. After each chest compression, we want to allow for full chest recoil. You guys don't have to stay on the floor. You can get up now if you want. Thank you. Why do we want the chest to recoil all the way?
So the heart can refill.
So the heart can refill, right? You don't want to leave any pressure on the chest, okay? This is especially true when we're talking about our infants in our pediatric population. The weight of your hand, even just sitting on an infant's chest, could be enough to impede the heart refilling back up. Yes? Use continuous compressions when appropriate. Always appropriate. If we were going to do breaths, we would make sure that we're opening the airway to make it easier for us. You do that with what's called a hip tilt chin lift. We're not going to do that. We're not going to do. So now here's our examples of what we're not going to do. Mouth to mouth, pocket mask, which was in that yellow case. We had a picture of it earlier. Rescue breathing is referring to when you have people who do have a pulse, but maybe are not breathing. Most often, what type of emergency do you think these people are suffering from? Asthma, maybe.
Respiratory.
Sorry? Someone say it over here.
Respiratory.
Choking. Drowning are overdoses. These are going to be your overdose people. This is what happens first. This is why people who are overdosing go into cardiac arrest. It's because the drugs that they are taking bring down their respiratory drive. Their body forgets to breathe, so they're not breathing. And then because they're not breathing, that's why their heart would stop and they would need CPR. So when we talk about rescue breaths, it's mostly for that population. Again though, if I'm not at work, am I gonna give rescue breaths? No, and it's not because I, am a mean person. It makes more sense to give them Narcan and then to do compressions when necessary, okay? So for our children, that's 1 year, like a 1-year-old to puberty, check for responsiveness and assess for breathing. If they're not breathing or not breathing normally, call 911. If you're alone, do 2 minutes of CPR and then call 911. Is that different than our adults?
Yeah.
Yes, with our adults, if you see them down, they're not breathing, you would go get your phone and then come back. For kids, you're gonna do 1 cycle of CPR and then go get your phone and come back. Not 1 cycle, 5 cycles, 2 minutes. When it comes to our kids, do you think we need to use the weight of our whole body with 2 arms? No, they're little guys, right? You can just use 1 hand straight down and press down, kind of the same. We don't want to get tired, we don't want to exhaust our arm, but they're smaller, right? So kids, when it comes to kids, it's kind of a choose your own adventure there. The number 1 reason that kids go into cardiac arrest is what? Some sort of oxygen not getting to their body is usually the reason, right? So if you do want to do your breaths, it could be more helpful for a child than for an adult who's not suffering from a hypoxic event. You will push down on the forehead and lift up the chin. Put your mouth either over their nose and mouth if they're small enough. If not, then you'll pinch their nose when you lift the chin. When you push back the forehead, you can give 2 breaths, okay? Do you think a 4-year-old needs you to take a big breath and then breathe that into their chest? No, just until you see chest rise, which is going to be very difficult when you're dealing with a child who's not breathing, but you'll tilt their head back, and when you give your breath, look and see the chest rise that way. Pocket mask. Again, we want to deliver them each over 1 second, each breath, so you're not going to go. We want it to be nice and slow. All right, 30 chest compressions at a rate of 100 to 120 minutes per minute. Is that different than adults? No. It's one size fits all when we're doing compression rates. All right, for your infants, check for responsiveness and breathing. Shout loudly into the infant's ear, tap the bottom of their foot. If not breathing or not breathing normally, call 911. If you're alone, do your 2 minutes and then go get a phone. Chest compressions for infants, so under a year, 2 fingers, okay? And when you guys, I can talk about this all day, but it doesn't matter until you're actually doing it. So you'll see, it's harder than you think, but we want to make sure we're not actually over compressing, okay? Kids' airways, super duper tiny. Like an infant, I want to say it's smaller than your average drinking straw. So if you push the head back too far, you could kink it backwards. If the head comes too far this way, it could kink forwards. Their necks are so fat, sometimes it's really hard to figure out exactly how they're going to be anatomically straight. Their heads are giant. They're just really disproportional. They really didn't, think about that when they came out. Sometimes, though, it's helpful if you put something under their shoulders to align their head straight. In this setting, it's probably not something we're going to overly think about. We'll show you how to do the compressions and how to do the choking maneuvers. So for your infant breathing, mouth over the nose and mouth, 2 breaths. Again, infant lungs this big, your lungs this big. Again, 30 compressions, rate of 100 to 120 a minute. Where have we seen that before? Yeah, kids and adults. All right, AED, what's the point of an AED? We're almost done with the PowerPoint, I apologize. To try and get the heart beating again? What does it do? Shocks them, right? We've all seen it on ER for my parents and Grey's Anatomy for my kids. It's very dramatic. They take the 2 paddles, they rub them together, they say clear, and the person jumps and they save their life, and it's amazing every single time. We don't do that. Even in the hospital setting, we're not using paddles unless they're in the OR. So on the ambulance, in the hospital, and the ones here, they're gonna look like this, and they're gonna have the pads. They've made this pretty easy for us, right? There are pictures on it. It tells you exactly where to put each pad, and then it'll talk to you. It'll tell you what to do. It'll also have what's called a metronome, which will keep the pace of when your compressions are supposed to be. It recognizes that there's a cardiac arrest that requires a shock, tells the rescuer when to shock, and gives it. Not that we're going to go into echocardiograms and such, but there's only 2 rhythms that it will shock. These are what they look like. But on TV, I know that they shock the flat line. It's not a shockable rhythm. It's not going to do anything with that. It'll recognize that that's not something that needs to be shocked, and it'll say no shock advised. These 2, ventricular tachycardia and ventricular fibrillation, those are the 2 that it'll try and shock and get the electricity back to how it's supposed to be. %90 chance of regaining pulse with the first shock if given within the first 5 minutes. Pretty big deal, right? That's significant, okay? Which is why it's nice to have AEDs everywhere. Because how long do you think it takes for an ambulance to get to your house in Quincy on average? On this is your good day, not at rush hour, not in a snowstorm. 15 to 20 minutes. For an ambulance, 911?
Probably 6.
So we're looking at approximately 6 to 8 minutes, right guys? We talked about that this week. You're looking at approximately 6 to 8 minutes. There are issues now post-COVID where, yes, it is taking a very long time. There's nothing to, it's not Brewster's fault, it's not Quincy Fire's fault, it just is the case now. Hospitals are closing, the ambulances are further away. I promise you everybody's doing our best. There are extended periods of extended dispatch lengths for when an ambulance gets to you, which is why it's good for us to know life-saving measures that we can do before the ambulance gets there. Additionally, who else has AEDs that might come with the ambulance? The fire department, or before the ambulance, or who else? The police. There are way more police cars and fire trucks than there are ambulances. Most of the time they're going to go to these medical emergencies and can start administering help when they get there. First step, turn it on. Next step, figure out what kind of pads you need if there are multiple pads in there. Open the pads, peel away the plastic backing, attach the sticky side to the bare chest. They'll go like this, okay? Plug them in. Allow it, so once you turn it on, it'll say, like, analyzing heart rhythm. Please stay off, please don't touch the patient, or please stay off the chest. When it says shock advised, it'll beep, it'll get very loud, it'll doop, that's when it's charging, and it'll stay clear of the patient. The shock button will illuminate, and that's what you'll press. We need to make sure that nobody's touching the patient when it shocks. Why? They could get electrocuted. It's a pretty smart machine. It can tell me whether the patient's in a normal heart rhythm, a very bad heart rhythm, the flat one, or one that it can help. That's a smart machine. Can it tell the patient's body from your body if you're touching? No. Will that kill you? Do you think? It depends. What are your underlying health conditions, right? If you have an underlying health problem or electrolyte problem, it could cause a lot of damage. For the rest of us, it'll hurt, okay? It'll hurt. You'll have to go to the hospital to be monitored. Probably won't kill you. Not something I'm trying to test with anybody. Press the shock button if it tells you to. Start CPR after the shock is delivered, starting with compression. So using it on a child, again, wherever the pads tell you to go, put the pads there. If the child is so small that when you put the pads on, they're nearly touching, go to the front and the back. The pads should be able to tell you that. The AED should be used as soon as it's available. All right, what are some special considerations we want to figure out? Are the pads going to stick well to this chest? No. No. What's it going to do? It's just going to like pull the hair, right? We want it to be on the bare chest, so that means no hair. How do you think we can rectify this situation?
Find a bare spot.
Find a bare spot.
Just wax them there on the spot.
Wax them right there on the spot. That's exactly it. Make sure you have a second set of pads, ideally. But press those down real hard and just rip them off. Put your second pads right there, okay? It's funny, but that's actually exactly even on the ambulance. That's what we do. It's fast. We have little razors. There's probably going to be a razor in your AED also. If you don't have a second pair of pads, because you don't want to waste one of them, go ahead and give that a little shave. It'll be the worst, bumpiest, hair-pulling shave this person's ever experienced. But what's worse, like a bad shave or being dead? Being dead, probably. What do you think is happening in this picture? It's hard to see.
Sweat.
Sweat, or it's wet, or this person is, post-drowning, or it's raining out. What do we want to do for that? Just dry them off. They don't have to be completely dry, but especially on the chest, we want to dry it off to the best of our abilities. The pads won't stick well if it's wet, and water can conduct electricity. We just don't try and keep it dry. Can anybody tell me what's happening down there? Oh, it does kind of look like that's a bad one, a popped out clavicle. What else could that be?
Pacemaker.
Yes. Say it again. Okay, a really bad bump, yep. Anyone else have any ideas what that might be?
Pacemaker.
A pacemaker, yeah. So an implanted defibrillator or pacemaker. We don't want to put our pads right over that. Can anybody tell me why it's not really an issue for this picture exactly? Where is that located on that person's body? Left chest. Where are we putting our pads? Right chest, left side. Even though if they have a medical device in their right chest or down, just put it either lower or to the side. Just don't go right over these. Can anybody tell me what that is, that little shiny thing right there?
Patch.
A patch? Yeah, it's a medication patch. So do you think we want to put our pads right over medication patches?
No.
Do you think we want to use bare hands to remove that medication patch? No. So even if you don't have gloves, like use a shirt or a sweatshirt or something, remove the medication patch and wipe it dry. I say we don't want to use bare hands because sometimes medication patches, like a lidocaine patch for when you have like a backache, that's not going to really hurt you. There are people who have fentanyl patches and something called a nitro patch. Can that patch tell if it's your skin or their skin? What happens if you touch that medicine? You'll feel the effects of it. So we want to make sure we're not just like going right at it with our hands or our, skin. All right. Is someone choking if they cough?
No.
If someone says, I'm choking, are they choking? No. And if they're breathing, are they choking? A true choking emergency is when there's a complete blockage of the airway, so there should be no sound whatsoever, no breathing whatsoever. If they are breathing, coughing, talking, should we intervene? No. Let them figure it out on their own. If they can't breathe, there's no cough and they're not making any sounds, that's when we want to intervene. That's when we'll do the Heimlich maneuver or abdominal thrust. Can anybody tell me what body action we're mimicking when we're doing abdominal thrusts? Gagging, compressions, sort of throwing up, yep. Coughing, exactly. we are doing, with compressions, we're doing external compressions of the heart. With the abdominal thrust, we're doing external coughing for the patient. We want to try and push all the air out of that body to force that up, okay? We'll go over hand placement better when we're down in a smaller group. When it comes to a child, we'll get down to their size. So for an adult, they'll stay standing. You'll come up behind them. For a child, get down on their level. So take a knee, get down on their level. Never thrust enough to get them off their feet, but we want to be pretty strong in what we're doing. How do we know when to stop doing abdominal thrust or the Heimlich maneuver? Yes. Okay, when extra help arrives and they say, I got that. Yep. When they start breathing again, right, that thing comes out, they vomit, they say, thank you so much, you're a hero. What is the other option for how this ends? They what? They go limp, exactly, so they lose consciousness. When you have a complete blockage of the airway, you're not getting oxygen in. When you don't get oxygen in, what happens? Yeah, you pass out and eventually your heart stops. So what do we do if the person passes out? CPR. Gently put them on the ground and we're going to start with our compressions. Pregnant women and large victims, wherever you can get your arms around their body works. All right, infants, when it comes to infant choking maneuvers, we're going to put them on our arm, do 5 back lows, 5 chest compressions. I'm going to gloss over that now because we're going to do it hands-on. If you get nothing else from today, you will get how to properly do choking maneuvers for an infant, okay? Something I feel very strongly about. And same thing, we'll stop when either the baby is responsive, breathing, crying, or if they've gone limp, we'll go right to our compressions. All right.
Hi, my name is Benjamin. I'm an EMT with Brewster Ambulance, and today we're here at Quincy Central Middle School teaching the community CPR training. And what we're doing here is rotating groups of parents and students alike for CPR compressions, airway management, and how to be first responders themselves in the community. It's a good community outreach, and yeah, everyone's doing great so far. And I hope that they can come away with something today. So we've got paramedics with Brewster, 911 operators with Brewster, and we're just here supporting the community. So here we are at the CPR station. This is going to be the compression station where students are learning the proper techniques and the proper methods of doing compressions on adult patients. So here we're doing just drills, and next we will do airway and AED placement as well. And at this station we have how to identify choking and how to place AED. This is important because it allows students to recognize the differences between cardiac arrest and choking in patients and how to address both. AED placement is also very important when performing CPR. Okay, here we have, similar to the adult station, we have the pediatric station for CPR, which is different than adult techniques. Here we have pediatric dummies, which require less pressure to perform compressions, and it's important to know the difference and how to address different types of patients and what you might find.
Yeah. So in their infants' heads, like their necks, they're gonna wobble all over the place. Make sure you secure it. You can put it over your arms like this if it's easier. If the infant is heavier, like for the children, another way to do it is if you're down on the ground, you can support it with your knee. And you're just going to keep doing the compressions until 911 comes, okay?
The shoulder blades right here. Hard. We're going to do 5 back blows. Now everybody says, well, I don't want to hurt the baby. But what happens if we don't get this object out? It's going to choke to death, and then we don't have a baby anymore. So You know what? If we hurt them, we kind of have to hurt them. We'll fix it after, right? So you're gonna go 1, 2, 3, 4, 5, and then we're gonna grab by the head and flip over, 2 fingers in between the nipple line. 1, 2, 3, 4, 5. And we're gonna keep doing that back and forth until the object comes out, or we have to start CPR.
All the way deep. Yeah. And it makes it easier, but so instead of going like over here,
Or what are we trying to do? Trying to get it out, right. So we're going to keep doing it until it comes out, until somebody with more training comes, until the ambulance arrives, the nurse, the doctor, whoever.
No, don't worry about the AD.
Did the choking in CPR?
Yeah, because the choking.
Yes, right, absolutely. You know, yeah. So, yes. No, we don't breathing unless for like yeah. Most of the
Hands on.
Put your hands right there and do the same motion. Alright?
very scary.
So a bigger person. Okay? We'd also do that for pregnant women. Alright? Again, because some of you can't get your arms around a pregnant woman depending on how big the belly is. And also, we don't want to be pushing on the baby. Alright? Make sense?
Get some arms and use your upper body to really push in, really compress that chest. A lot deeper that way.
On the abdomen, just above the belly button. Alright? And you want to picture the straddle the patient. So one leg out. Because especially if you put someone on my side, and I go unconscious, you take me on the floor, you try to take me on the floor, you'll come away. Lock your elbows. And you're going to go straight down. Feel the difference? Yes. Yeah, it's a lot easier. Okay, cool, perfect. All right. So what we're going to do is, first thing you do when you get the AED is we turn it on, all right? Because the first thing you do when you're in a dark room, you turn the light on, right? Directions are all right on it. So it's telling me to apply the pads as it's shown, okay?
And apply pads onto patient's bare skin. Press pads firmly on skin.
All right?
Apply pads as shown in the pictures. Apply pads as shown in the pictures.
Okay, done.
Press pads firmly on skin. Do not touch the patient. Analyzing heart rhythm.
All right. So when you're analyzing, you want to make sure that nobody's touching them, all right?
Analyzing heart rhythm.
Do we know why that is?
Do not touch the patient.
Yeah, because it'll pick up any rhythm. It'll also pick up yours, all right? Now it's going to tell you to shock them. You want to make sure nobody's touching them, all right? All right. They'll have a slight jolt. It's not like on TV where they jump off the table, all right? You can't really hear it when you're standing, but there's a little tick, 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 tick. That's 100 beats per minute. That's it. They want you to go right back into CPR and get on the chest and stop pumping. Okay?
5.
it's fine.
We're not going to go gentle
good as
because we need to get that object out, right? So we can't go, oh, baby, because if we don't get that out, we can't help baby. So 1, 2, 3, 4, 5. hold the baby by the head, flip on the other side, still keeping the head down, and in between the nipple line, 2 fingers. And we're going to do 5 times. 1, 2, 3, 4, and 5. Okay? Now we grab the baby by the chin again, and we repeat. 2, 3, 4, 5. Flip again. 1, 2, 3, 4, 5. When do you think we stop? Until it comes out, right? Or rescuers come here. The good thing about babies are very portable. So we can take the baby and go, right? We can meet the ambulance outside. Okay? Great idea.